All right, Kiana and Sarah, floor is yours.
All right. Well, hi, my name is Kiana Franklin. I am the director for the JC Mash Free Clinic, and we are a branch of Bayside Housing Services. Today I have Sarah Anderson with me. She is a case manager for Bayside Housing Services. So I'll go ahead and share a little bit about JC Mash, and then I thought I'd have Sarah share some of our housing information. So JC Mash was started about 30 years ago here in Jefferson County. Bayside Housing Services took us over in 2023. And right now we have two locations. We have one in Port Hadlock where we see patients on Monday afternoons. And then we travel to Port Townsend on Tuesday afternoons where we see residents at the emergency homeless shelter. We have four doctors on staff, three nurses, and we've recently partnered with Discovery Behavioral Health, and they often will join us at the shelter as well. So we're able to see people for medical, mental health, substance use disorders. It's a pretty great combination there. We're really happy to partner with them. Let's see, last year we saw right under 300 people. This year we've seen a big increase. I think we're closer to 450 people so far. And that's, our clinic is only open 4 to 6 hours a week. So it's quite a big improvement this year. We're also just getting ready to start a new location at Discovery Behavioral Health. We're hoping that we'll be able to open that up for one more day a week, starting in the beginning of June. Let's see what else we have. We've also have a partnership with Jefferson Healthcare. So for the people we see that have no uninsured or underinsured people, we can do free labs, x-rays, mammograms, which has been really helpful in that regard. So we do a little bit of outreach as well, helping people get set up with counseling, case management, getting people insured that aren't insured, and whatever else we can help with. We do Indeed resumes and filling out job application type things as well. Yeah, so I don't know if anybody has any questions.
Can you um just walk me through like how someone could get connected to you and like what that
Absolutely.
process looks like?
Yep. So a lot of the people we see just come in. So we do have a free food and clothing pantry. I would say a lot of our people, the clients we see come in for food and clothing, and then start to get connected. But right now it's a referral basis. We get a lot of referrals from the hospital. A lot of our outreach programs, like the Real Team, the lead team send people toward to us. Our website is on baysidehousingservices.org. Um, yeah, so we don't ask for any payment, no insurance information. We don't even actually check IDs at this time. It's very, very low key, no barrier to get people seen by a doctor. We're obviously seeing a lot of our own residents too from Bayside Housing.
With the structure that you have set up, are clients who have barriers with transportation, are they able to use paratransit to get to your services?
So we're right on the bus stop. We're about a block away from the closest bus stop. So that's been very helpful. We do some transporting. If we have it, people signed up ahead of time, we can pick people up from certain locations on request. Our providers here do the fill out the dial-a-ride applications for people. So we can not only help them come see us, but see other providers or counselors that they may need to see as well.
Does anybody else? I feel like I'm asking a ton of questions, so I'm sorry. Does anyone else have questions for Kiana?
You're asking all the good questions.
Okay. Yes. The
Okay,
other
should I
question
have?
I,
Uh-huh.
the other question I have that comes to mind is when folks are coming to seek care from you, are they coming to like establish care, or is this like one and done type of situations?
Well, I would say it's both.
Okay.
A lot of the people have seen this year haven't seen providers in a really long time, maybe 5 to 10 years, some even longer. Um, I would say probably a majority of the people are on waiting lists to see a primary care, but it's anywhere from 2 to 6 months before they're able to see their primary care. So we kind of just fill that gap in between. We do see, the occasional somebody, oh, I just saw your sign. I've had a sore throat or my ear hurts for the last couple days type situation as well. It's kind of more acute things.
That makes sense. And then you mentioned that you also support with like employment pieces. Can you talk a little bit more about what that looks like and how folks can get
Yeah.
involved?
So when we're at mostly, I mean, it's at both locations, but I would say we do more of that when we're at the emergency homeless shelter. A lot of the people I see down there are not sure how to navigate setting up an Indeed account. I've helped several people do that. Some people just have the old-fashioned paper, which I didn't even know were a thing anymore, but I've helped several people fill those out, applications. Just trying to get people connected with the right places. And some people just don't even know where to start with, where to look for work.
Holly, I see you off
Oh,
mute.
hours or
She left. Never mind. She'll come back. Great, she's back. Yay. Molly, did you have a question?
yeah, my internet just kicked me off. Sorry. I was just wondering if you ever have to turn people away, like if too many people come during your open hours. If I was referring someone to come and just to know, like, not to come the last 30 minutes or something like that. I don't know.
Nope. Well, in our Port Hadlock clinic, we have never turned anyone away. Our doctors will stay until they see everybody here. Occasionally when we're at the homeless shelter downtown Port Townsend, we have told people they will wait until they see us walking out the door and then ask when we've already locked everything up. It kind of depends on the situation as well, but we have occasionally told people then, like, oh, let's see you next week, see what's kind of going on. But typically, no. If there's a line out the door, we're going to see everybody that's here. I think
Awesome.
it takes a lot of courage for a lot of these people to even make that connection with us and bring themselves to our clinic. So the last thing we want to do is discourage that.
Great. Sarah, I'm curious to hear a little bit about your programs and services and how our community-based workers can get connected to you.
Yeah, well, I'm Sarah Anderson. I'm a case manager with Bayside Housing and Services. Um, we have, right now we have several locations. We have a hotel building next to the old alcohol plant hotel that's transitional housing. We have two separate tiny home villages, one in Port Townsend, one in Port Hadlock. We have permanent supportive housing. Where the old Hadlock Motel used to be. We have that over there. That's for people who have a disability and who have been homeless for more than a year, and it's permanent housing for them. Then we have the shelter, the night by night shelter downtown. That's a good one. Right now we have about, I'd say 50 residents with the tiny homes and the old alcohol plant hotel section and permanent supportive housing. And we're really unique in that we're not, except for permanent supportive housing, we're not permanent housing. Our goal is to house people with us, but our ultimate goal is to be moving people on to more permanent housing. And I think we're really unique in that no one else really does what we do in this area. So um, And yeah, it's a 2-year limit at the Transitional Housing Hotel and also at the tiny homes. And basically what we do is we just people who are experiencing homelessness, we house them, we help them get their basic needs met, give them a little rest, and then we work on helping them find permanent housing. And sometimes that's helping someone fill out an application or talking to landlords or things that seem basic to you and I, but are a little intimidating for some people. We just help them along and that can be like our ultimate goal is moving towards permanent housing, but we help them work on other goals that tie into that, mental health goals, physical health, helping them get services for that, financial, um, yeah, all that kind of stuff. So we just to support them in any way we can so they can get back on their feet, learn the skills they need to transition from homelessness into permanent housing. So, yeah.
Curious, are you all one of the foundational community support um, providers in Jefferson County?
Yes, we are. We just kicked that off earlier this year,
Okay,
billing Medicaid for services, supportive housing services, and supportive employment services.
you're doing it for both.
Yeah, you
That's
can
really
do it for
awesome.
both. Mhm.
So if we have some of our care coordinators who are working with Olympic Connect, who they're supporting those that are looking for support with social needs, and sometimes they have complex clients that are needing like intensive housing support. Would it be appropriate for them if they're finding that to do like a warm handoff for you all to do that case management for clients? Just trying to find like more resources for our care coordinators who are doing that work.
Right, well, so I don't want to interrupt, but
Oh,
well, we just started this partnership with Discovery Behavioral Health. So all of our new residents that will be coming on board will go through Discovery Behavioral Health so they can get assigned with case managers, they can get SUD treatment if needed, mental health, and then they will refer them back to us for the housing type situation. So
So it's
that
like
way
an
we can,
internal referral for,
yeah,
yes,
you can.
yep.
okay.
That way we can really kind of treat the whole person best we
Mhm.
can.
Yeah, we wouldn't necessarily take on case management with someone who's not a resident, but we can provide support for those people. We can provide support for coordinators and case managers with other agencies. Collaborate a little bit. We collaborate heavily with just about every agency and organization in the county, basically, to support our residents. So we work closely with Fire Cares, OLICAP. We refer people through Olympic Connect a lot. Mhm.
That's nice. Yeah, you do. I process
Yeah.
some of those, so that's good. Don, Molly,
I had another question.
comments? Go for
So
it.
is there good times to reach someone at the office in Bayside if someone is trying to call? I know we're also very busy, but I do hear a lot from my clients. Oh, I call all the time and no one ever answers, which I'm sure is could be you know, elaborated, but
Yeah, well,
Well,
we've corrected that. We got a number on our website. Can't remember the number. It starts with 881, but it's on the website in the housing inquiry section. And that's a message phone. We corrected that. Someone is monitoring that all the time. And we're calling people back on that. It's a message phone, but we will call people back within a few days. So,
Does
yeah.
that mean it's a message phone?
well, so now actually, I think it's ringing to the front desk.
Oh,
So yeah, I've been getting some calls myself. So we realized this maybe, I don't know, maybe 2 months ago that we weren't sure where all the messages were going. So we've kind of rerouted things. Actually, a lot of times it's ringing up to the front desk at the old alcohol plant, the hotel there. And then they usually send us an email with the information, and we make sure to get back to those calls as quickly as possible.
yeah.
that's great. So the number on your website is the most current. number to be
Yes.
calling?
Yep.
Okay.
It's just been updated recently.
Perfect. Thank you.
And there's always the JC Mash phone as well. We do get some housing calls on that number, which I'll put in the chat here. Never hurts to have two numbers.
Great question, Molly. Any other questions for our guests before we wrap up? Dawn, I see you off mute.
Can you hear me? My
I
things.
can.
Okay, my thing kept saying I had audio thing. Could you speak about the coordinated entry? I've always been told that OLICAP is the lead housing organization for coordinated entry. How does Bayside and OLICAP work together?
We actually used to do coordinated entry a while ago, but we don't quite do that anymore. But OLICAP is the lead. That's the place to go to get an appointment to go through the coordinated entry process. And after that, people go on the Jefferson County by name list. And we pull from that sometimes, we pull from our wait list sometimes, but OLICAP pulls from the Jefferson County by name list 100%. So OLICAP is the best way to go about getting into their housing and sometimes getting into our housing. But we're kind of moving away from coordinated entry now. Yeah, so OLICAP would be the lead for that.
Okay, so with the Bayside housing, it's best to do the housing inquiry on your website.
Yes,
Do they
exactly.
still need to do the OLICAP coordinated entry?
Not
No.
to get to us, but that's a
Okay.
very good idea to do it anyway.
I
Yeah.
always direct people to do both, and then I was told no,
Yeah.
OLICAP's the lead organization. They have to go through OLICAP first, and it's so confusing as a community partner that's trying to help these people.
I understand.
Yeah, things are always changing.
So for us as well, if it's going through our website, but we are requiring all our new residents to have case management at least through a service, and that's where we partner with Discovery Behavioral Health. So that is always another option, is to start those services, and we'll get that referral quickly from them.
That answer your question, Dawn?
Yes, thank you.
Tina.
I have a question. I have a client who said that he had a limited stay of 60 days at Bayside. Is that something that is, could you explain that a little bit more? And then like how do we help people after they are out of that 60 days? I'd love to learn more because I'm not sure what it
Is
is for
that
you.
through Opportunity Council? Were they a veteran perchance
Yeah,
or?
veteran, yeah.
Okay, that is that's run by Opportunity Council. We have a few rooms over at the hotel that for veterans, and Opportunity Council has a program where it's more temporary, but we're not we don't case manage those people. They select the people, and yeah, Opportunity Council would be the best, person to ask about that.
Okay. Do you know how I find that number? Or I mean, I can connect with you after the call too, maybe. I'm just so confused as to how to help this person.
Yeah. They're a veteran, correct? You already said that.
Yeah, and I was excited they finally got into housing because he's been waiting since October, and then now he's out again. I'm like, oh
Mhm.
God, here we go again.
Mhm.
Start beginning again.
Yeah, we might have been a little confused about what it was. Opportunity Council. Does he work with Olivia at the VA and stuff like that?
Yes, uh-huh. Yeah.
Yeah, definitely keep in touch with Olivia. We
Okay.
have some VASH units for people who have VASH vouchers. However,
Mhm.
those are full right now. But yeah, just keep working with Olivia. That's the very best,
Yeah. Okay.
very best thing. And Jay Rios with Opportunity Council is at the VA office or VA center in Port Hadlock Wednesdays.
What did you say that name was?
Oh, Jay Rios with Opportunity
Jamie.
Council. Yeah.
What's the difference between those programs? I'm unfamiliar with Opportunity Council.
Oh,
I
let's
gotta
see.
let Sarah do this.
Yeah, Opportunity Council works solely with veterans. And to be completely honest, I'm not completely 100% sure everything they do, but they just help veterans with housing, just every kind of resource you can imagine. Um, they have housing case managers, they help people um, get on the VASH program, get their basic needs met, things like that. So, employment, they help veterans with employment. Yeah. So at the VA office or the center in Port Hadlock, Olivia's there Wednesdays 10 to 1, and so is Jay Rios with Opportunity Council. So if you have a veteran, definitely send them there.
Okay, sorry. Can you say Wednesdays? Where are they at?
Oh, they're at the VA center in Port Hadlock. I think it's on Matheson near the VFW. I think it's a
Oh, VFW.
VFW.
Yep.
Yeah, the VFW. And Olivia Reiber with the VA is there Wednesdays, and so is Jay Rios with Opportunity Council. Yeah,
Okay. Do
so
you know what time?
usually 10 to 1 or 10 to 2, something like that. Yeah,
Thank
middle
you.
of the day. And sometimes they have dinner, so that's nice too.
Okay,
Yeah.
thank you.
This was great. Such a good opportunity to like talk to you all in real time and get some clarity on common questions we're seeing from our care coordinators. So this was really good. Um, my final call. Any other questions that we have for Sarah or Kiana today?
Now, that's like a MASH clinic. Are these volunteers that are working there?
Yes, everybody is a volunteer, all of our doctors, all of our nurses. We just had a therapist who his last day was on Tuesday. He is retired again for the second time. So I'm not sure if we'll get him back or not, but I'm kind of working on it. And we're still looking for another therapist to join our team as well. But yes, all volunteers.
Do you have other support staff like medical assistants that also assist with this?
Well, I'm a medical assistant myself, so I'm the only medical assistant right now. But we have a few medical assistants. I have an LPN and a couple nurses who would like to join our forces here. So kind of waiting for that other clinic day to open so that I have more spots. It's amazing how many people all want to volunteer on the same day.
Well, I think that's amazing. What about medications? Are you able to obtain those?
So we've heard a lot of people from other agencies, other free clinics talk about having issues getting people able to pay for their medications and pick those up. We have only had one instance in the last 3 years where someone was unable to afford them. And actually, my doctor that was here provided that. We do have a little bit of donations that we can help people with that. But so far, we've been able to get the people who aren't covered in a way. So it hasn't been a big issue for us. Not yet, anyways. We'll see what's coming down the road. I am a little nervous.
Especially for some of the psychotropic medications, it can be very expensive. And
Absolutely.
clients or your patients that do that. I was just curious about what your resources were. So it sounds like you haven't reached an obstacle yet.
We haven't, yes, we haven't reached that point. I'm really hope I don't have to see that, but I'm pretty sure it is coming down the line here. The Port Ludlow Pharmacy, though, here in Jefferson County, they do have programs to work with people to get them set up, which has really been wonderful. We have used them quite a bit.
Thank you.
Yeah.
Well,
All
Kiana
right.
and Sarah, I want to thank you for your time. You all have been so amazing, and I just appreciate the resources that you can provide for um, our clients and for our care coordinators. Um, it sounds like the best way to get a hold of you all is through your website. Do you want to throw that into the chat so we can
Oh, sure
make sure
can. Yep.
folks know where they can send folks? And then Kiana did a great job of adding the JC Mash phone number into the chat as well. So um, that's great.
doesn't look right.
Awesome. Well, thanks y'all for your time and really appreciate you being here. And we'll see you. We'll see you again soon.
Thank you. Thanks for having us.
Awesome.
Thank you for
Take
having
care.
us. We appreciate it.